Good morning, and thank you for joining us. Today, the main topic of our briefing is our plan for booster shots. So I'll turn to Drs. Murphy, Walensky, and Fauci in just a moment. First, I want to provide a brief update on our fight against the virus. We continue to see a rise in cases driven by the more transmissible Delta variant, with cases concentrated in communities with lower vaccination rates. So this remains a pandemic of the unvaccinated. We know getting more people vaccinated is the best way to end this pandemic. And thanks to our relentless efforts to get more shots in arms, we are making progress. In the last 2 weeks alone, nearly 7 million Americans have rolled up their sleeves and gotten their first shot. 7 million, that's the highest 2-week total since the beginning of June. And over the past month, we've also seen a 75% increase in the average daily number of 12 to 15-year-olds getting vaccinated, particularly important as adolescents begin going back to school. And once the numbers from today are reported, we will have reached 200 million Americans with at least their first shot. 200 million Americans with at least one shot. That's a major milestone. Americans across the country are continuing to step up, do their part, and get vaccinated. We are using every lever at our disposal to fight the virus, including by ensuring state and local leaders have the tools and the resources they need to get more shots in arms and to respond to any outbreaks caused by Delta. Our COVID-19 surge response teams are a whole of government effort with experts and personnel and resources from HHS, CDC, FEMA, the Department of Defense, and the Department of Veterans Affairs. These surge response teams are now working with 16 states to address their particular needs, from deploying hundreds of personnel to provide medical care, to standing up free testing sites, to surging critical assets like ventilators and ambulance to strained health systems, to getting shots in arms, including through the use of mobile clinics, to sending and supporting the use of life-saving treatments. And we will continue working closely with states to do all that we can and to match resources to their needs. Just yesterday, President Biden directed FEMA to continue fully reimbursing states, tribes, and territories for all eligible COVID-19 emergency response costs through the end of the calendar year, a 3-month extension of the order he signed on his first full day in office. Importantly, this maintains 100% federal reimbursement for state deployments of National Guard personnel for critical COVID-19 missions. President Biden committed to the American people that he would do everything in his power to end this pandemic. And from his first day in office, the president has marshaled a wartime effort to do exactly that. We've been preparing for every scenario, including the potential need for vaccine booster shots. Our approach on booster shots is simple, and it's consistent with our approach on every other front of this war. Be guided by the science, and always, always stay one step ahead of the virus. Now let me turn it to Dr. Murphy to discuss our booster plans, and then Drs. Walensky and Fauci to discuss the science behind the plan. Over to you, Dr. Murphy.
Well, thanks, Jeff, and it's good to be with all of you again today. Today, I want to update you about where we are regarding boosters for fully vaccinated individuals. Our top priority has always been protecting people and their families with from COVID-19. And we have been fortunate to have safe, effective vaccines that offer outstanding protection against the worst outcomes of this virus: severe disease, hospitalization, and death. The COVID-19 vaccines that are authorized in the United States have been remarkably effective, even against the widespread Delta variant. But we know that even highly effective vaccines become less effective over time. Our goal has been to determine when that time might come for the COVID-19 vaccines so we can make a plan to take proactive steps to extend and enhance the protection the vaccines are giving us. Having reviewed the most current data, it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant. Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. That is why today we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older. They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines. We plan to start this program the week of September 20th, 2021. I want to be very clear. This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines, and the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on a thorough review of the evidence. The plan ensures that people who were fully vaccinated earliest in the vaccination rollout will be eligible for a booster first. This includes our most vulnerable populations, like our healthcare providers, nursing home residents, and other seniors. We will also begin delivering booster shots directly to residents of long-term care facilities. For people who received the Johnson & Johnson vaccine, we anticipate vaccine boosters will likely be needed. The J&J vaccine was not administered in the US until March of 2021, and we expect more data on J&J in the coming weeks. With those data in hand, we will keep the public informed with a timely plan for J&J booster shots. I want to emphasize that this decision was not made lightly. It was made with careful consideration by the top medical and public health experts in the Department of Health and Human Services. It was informed by data, thoughtful analysis, and by our collective years of experience addressing illness and epidemics. As always, we will continue to follow the science on a daily basis, and will take whatever steps are necessary to protect our nation from COVID-19. This plan to administer booster doses does not change our commitment to vaccinating those who are not yet vaccinated here in the US and around the world. The overwhelming majority of hospitalizations and death continue to occur among the unvaccinated. We will continue to ramp up efforts to increase vaccination